Hi, Laura here again, and today in the final Portfolio 3 I'll be discussing the role of the nurse in preventing and managing post-operative nausea and vomiting if it was to occur. Post-operative nausea and vomiting has been reported to affect between 20 to 30% of patients within 24 hours of surgery. Conway 2009 addresses the point that nausea may occur without the presence of vomiting and still cause just as much stress if the patient was to vomit. Post-operatively, nausea and vomiting has been perceived as the most feared side effect of anesthesia, being rated higher than pain as the biggest fear. When preventing nausea and vomiting, the nurse has an integral role of assessing the individual patient's risk factors. This occurs before surgery. It can be completed months, weeks, and days before surgery. To reduce anxiety in the patient, this planning shouldn't occur on the day of surgery, in the immediate preoperative phase. According to Gibbison and Spencer 2009, risk factors for postoperative nausea and vomiting is female sex, which is thought to double or quadruple the risk compared to males. Smoking has seen to reduce nausea and vomiting, so you're at higher risk if you're a non-smoker. Dose-related opioid has seen to increase the likelihood of occurring postoperatively. Longer duration surgeries normally increase the risk of a patient developing it. And motion sickness history, as well as nausea and vomiting in the family, indicating there could be genetic connections. Depending on the risk factors a patient has, determines the level at which they are classed. A patient who is at high risk is a good candidate for prophylaxis treatment. Collins 2011 indicates that a patient at high risk could be considered to undertake altered anesthesia considerations such as total intravenous anesthesia or regional block NSAIDs, as well as pharmacological prophylaxis options and non-pharmacological options such as improved hydration pre-surgery, multimodal pain management, and acupoint stimulation. The nurse's main role is to continually assess the patient for stated complications and work collaboratively with the doctor to ensure comfort is maintained for the patient as well as possible throughout the postoperative phase and leading up and continuing into discharge. The role of the nurse continues if all prevention strategies and risk factors were taken into account and actioned, and post-operative nausea and vomiting still occurs. It's confirmed that symptom management treatment will now need to commence. If they are experiencing moderate to high severity of nausea and vomiting, 2 drugs are recommended from 2 separate pharmacological classes, seen to have the greatest effect when treating post-operative nausea and vomiting, according to Collins 2011. Evidence-based knowledge indicates for a patient experiencing post-operative nausea and vomiting, 4 mg of ondansetron would be the best effective for the patient who doesn't have an allergy to the drug and hasn't responded to any other preventative or managing interventions.